what advice could you give to aspiring medical students?
I think it's very difficult. It depends who you are and where you live, who you know. One of the things that medical schools love is something on your CV that you've been showing that you're a caring person. It doesn't really matter what that is, whether it's working in a granny home or a old age people's home or doing some sort of voluntary work. I think that's always useful. Some people can manage to go and sit in with their local GP, or they know someone, or someone's friend is a doctor who will let them follow them for a week, but that's becoming harder and harder to do. And I've found that I've had quite a lot of students write to me and say, I don't know anyone, I can't do this, my GP won't take me, and the problem is the health service is under a lot of stress. So to have a student tagging along with you, it's all very well, but it takes time. And I can see that that's going to be harder and harder in the future. I think it's very important that you show you care about people. Because let's be honest, being a doctor is about people. It's not about anatomy, it's not about physiology. Yes, you've got to know those things, but you've got to care about people. And almost I would say that in some ways the specialist surgeon cares the least about people. I don't mean that he doesn't, but he doesn't need to be a good surgeon. I will happily go to a surgeon who I know to be a good surgeon, even if he's not a particularly nice person, because I know that it doesn't matter to me personally, but to most patients it matters that you are nice to them, that you listen to them, care about them. I don't know, I think that's true of most people. I know that, for instance, when my children go to see a specialist, they will come home and they don't know if he's a good surgeon or good physician. I often do, because they're often my ex-students and I know what their sort of quality is. But the comment will be, he was such a nice, caring guy, he helped me on with my coat. Now, I know that sounds silly, but that's what the patient is often looking for, a bit of humanity. So I think humanity is very important in all doctors, and that's something that you've got to show in whatever way if you're applying to medical school. Of course, you've got to have A-levels. You've got to have virtually grade A's, I think, for all medical schools. And in a way, it slightly saddens me, because not all the people that get straight A's are going to make good doctors, and there are many people who get B's, or aren't the very top students, who actually would make very good doctors. I know one or two medical schools in the world where they don't grade you on your A's or B's. They give you complex exams and psychometric tests to look at your caringness. But there are only a few medical schools that do that. So I don't think there are many in Britain that do it. And it's very difficult. If you've got 3,000 people apply for Peninsula and you admit, what, 150 roughly? How do you sort them out? Well, okay, take everyone that's got straight A's, right, that's got it down to 500. Now, we'll interview those 500 and appoint 100. It's the time factor for the faculty. You just think what it's like, sorting out 500 interviews. It's hard work. And I've done them in 3 different universities over my career. It takes up a lot of academic time. And only when I got to medical school did I focus. But I think if you find the secret is to find something that you are excited about. And I don't care if it's research, I don't care if it's a different specialty in medicine. It may not even be directly medicine. You may find I'm passionate about the way the health service is run. You become a doctor and you end up being a senior manager in the Department of Health. One of my year did exactly that. He was a great administrator and he ended up as number 2 at the Department of Health. You know, literally. But I think it's important that what you do, you want to go to work excited to work. I never got up in the morning and thought, oh God, another day at the office. Never. Now that's partly my personality, but partly the fact that I have gone not for money. My salary is lower than all my colleagues. I have the lowest salary of all my year at med school, because professors in science subjects get very low salaries. My wife has kept me all our lives. She didn't do medicine for about 8 years, and then she was a mother, having kids, and then she went back into general practice, and as a GP, she has earned nearly double my salary as a professor all our lives. And she's not on a particularly high salary, she's just an ordinary GP. So, you know, if money interests you, then get out of medicine now, would be my comment. If you're going into medicine for money, you've chosen the wrong profession. Go and be a banker or a lawyer. If you're going to medicine because you like people, is a good reason to go. If you like going into medicine because you like science, is a good reason to go. And if you really like science and you find out you don't like people because they're all smelly, then go and do a PhD and go and work for the MRC or go and work in a research team. Quite a few of my Cambridge students have done PhDs and are now working at MRC units or research teams, some of them overseas. There are so many branches in medicine. I think having a passion, an interest in what you do makes so much difference. Because it's a tough job. I don't care what anyone says. Any branch of medicine is tough. There are different toughnesses in different branches. I'll give you one quick example. On Saturday night, I went out to dinner with an old squash friend of mine. He's a GP, and he and I used to play squash for 20 years every Sunday morning. I never won. He won for 20 years. We had a bottle of champagne at our house that if I ever beat him, we were going to crack the bottle of champagne. It's still sitting there. That's a true story. So we went out to dinner, and his wife came in to the dinner. It was in a restaurant in London. Came in for dinner on the canal, actually, in Kensal Rise, if you know where that is. And she came in about 8:30, about a quarter of an hour later. And the reason she came in late, because she was the consultant on call for the Hammersmith Hospital. So she's on for the whole of this week as the physician on call, dealing with all the big problems at the Hammersmith, which is a huge tertiary centre. And the reason she was late was because she is a doctor. Now, she's a very specialised doctor. She has her MRCP, she has a PhD in immunology. You know, she's a really high-powered lady. But the point is, even at her age, and I don't know her exact age, but let's say 55, 60, she is on call for a whole week, night and day, for a whole week. Now, at that age, being on call for 7 days running for a huge hospital involves a lot of physical and mental stress. So if you're not passionate about it, you ain't going to survive it. You're going to get really miffed and leave. So anyone in medical school thinks this isn't fun. And I know, of course, exams aren't fun. I'm not going to. We all have to go through the stress of those. But if they become a huge barrier, then don't do it, because medicine is always going to have lots of exams. It's quite hard to get away without doing exams, for instance, in medicine. But I've managed it quite well.
Thank you.